Okay, so Jacob has recently had surgery on his back for a spinal tumor, and because of the surgery, he's lost sensation in his part of his lower back and his legs. He's been gradually getting it back slowly over the years from his neurologist helping him out. So what we're gonna do is kind of do some light superficial effleurage to his legs to help stimulate, bring blood flow, and increase and promote tissue health. Also going to work on his lower back, around his QLs and erectors, to basically do the same thing and just try to improve his muscle tone. So we're going to start with his legs. So I'm going to drape his leg first. Now while I'm working on his leg, I'm also going to be putting a hydroculator on his lower back to help warm up the tissue. So with the hydroculator, what you want to do is, because he has lack of sensation in his lower back, you want to be checking in on it constantly and make sure his skin's not getting too warm. You feel the heat on your back. Jacob? Yep. Yes? Okay. Alright. Just let me know if you feel it getting too hot or anything, okay? So I'm just going to focus on basically his entire leg, going from his glutes, hamstrings, down to his calves. Just trying to warm up his tissue. You okay, Jacob?
Yep.
It's not in that version. Really? I have to look at my full version at home. And in the little SOT, it doesn't even reference the one off the table. So, called it a different, and then I looked in Kendall, and there's no name for it. It's just like, oh, I love that.
So we'd spend about 10 minutes performing the superficial techniques on both legs, and then I would move into the lower back. So I'm just going to move up into his lower back. Where's your towel? Do you have your towel?
Somewhere.
So I'm just going to drape your leg. And remove the hydroculator.
So you have 10 minutes left.
And now I'm going to drape back. can feel that his skin is warmer from the hydroculator. I'm just going to start by palpating around his QLs and lower erectors. Do you feel my hands or any sensation here? Jacob? Yes?
Yep.
Okay. So it feels like he has a lot of tone in his erectors from sitting in his wheelchair for a long period of time. Also in his QLs. From the assessments, we found out that he did have weakened QLs due from his neurological issues, because his loss of sensation and strength in his lower back and his legs. Okay. So I'm just going to start with some superficial techniques. Is the pressure okay?
Yeah.
So after I warm up his tissue, I'm going to start doing some muscle stripping to his erectors and then move into his QLs. So I'm just starting with lighter pressure, and then I'm going to ask Jacob how that was for him. Is that okay there? Good. And then you can gradually increase the pressure depending on his tolerance and what he feels. I'm going to do it again. Do you get any tenderness or anything through this? No, yeah. Are you getting tenderness in your back area?
No.
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 So you can feel his erector starting to loosen up a bit. And go through it one more time. Are you okay? A little tender there? Okay. Am I on the tender spot here? Yes?
Yeah.
Do you feel it referring anywhere else?
No.
No? I'm just going to do a specific compression here, see if it changes any of the tenderness he has in there. And I'm seeing a muscle twitch. So it's still tender in this area? Yeah? Okay. So I'm just going to apply some more specific compression to reduce the pain in here. So I don't want you to ever go over 6 on the pain scale that we discussed earlier. Okay? So what's it at now?
4.5.
4.5? Okay. So I'm just going to hold it here until the pain goes down. Just let me know. What's it at now?
It's pretty much gone.
Pretty much gone? Okay. I'm just going to do a couple more superficial techniques. And then after the pain's released, I would back out. To finish off, I'm just going to do some more superficial on his back. Obviously, I would treat both sides in a full treatment.